Hi, I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. Today's episode is outstanding. We have the doctor's doctor, Dr. Mitch Mally, the world's leading expert in joint manipulation and biomechanics. There are going to be some amazing takeaways that you're going to want to talk about with all your friends. Watch this episode. Everybody, Dr. Rob Silverman here, Proven Health Alternatives. I have the doctor's doctor. That's what we call him. The best adjuster I know, not in the U.S., but in the world, for sure, Dr. Mitch Mally. How you doing, Mitch?
Hey, I'm doing great, Doc. Great to see you.
It's a pleasure to have you on. I want to tell you a little bit about Dr. Mally. First of all, I had the honor of getting to lecture with him nationwide. He is, without question, as I referred to earlier, a doctor's doctor. He's the best adjuster. Everybody knows that. There's a line, there's no exaggeration, there's a line of virtually every doctor attendee to get Mr. Mally's, Dr. Mally's hands on them. So let me give you a little background. We shortened his bio because we'd be here all day. It's so impressive. Dr. Mally's a 1981 graduate of Palmer College of Chiropractic in Davenport. He is a Detroit native, former pre-med student, athlete extraordinaire, sidelined with a devastating knee injury, which we're going to talk about, prior to tryouts with the Detroit Lions. My New York Giants are really having an issue with you. It's here to join us. Dr. Mally's injuries led him on a personal journey in quest to continue his medical education, although not the adventure to becoming an orthopedic neurosurgeon. He elected to become a chiropractor, specializing in sports injuries, and not just spinal manipulations, but manipulations of virtually any joint in the body. That's exciting. Tell me about that knee injury, my friend. You were a huge athlete. You were like a three-sporter, I think.
Yeah, I played, well, back in the hood in Detroit, we didn't have these things today's technology have. The computers were the size of a room, not enough to fit in your pocket or purse. So we grew up outside like you did with a stick and a ball and a glove and your parents yelling at you, your mother yelling down, hey, come on, it's dinner time. So I participated in everything from martial arts to baseball to football, basketball, dribbling up and around, running around the city blocks, training to get stronger, better, faster. And that's what we did. On that venture, I decided I wanted to possibly do this chiropractic thing because I blew out my left knee. So my knee injury occurred in a pivotal move, which the majority of most knee injuries occur when the foot gets planted and the body gets torqued or twisted, be it on a wrestling mat, be it running bases, sliding into second base, or if you're kickboxing, or let alone jumping and landing in a basketball court, or for me, with a football cleat on a pivot and a kickoff return a week before tryouts with a professional football team. So, you know, people plan and God laughs. And it's quite interesting that a chiropractor on the field, of which I was 3 courses shy of med school. I was assisting in autopsies at William Beaumont Hospital in Detroit, world famous. There wasn't a shortage of bodies. So we did have the opportunity to train and learn an awful lot of the human body after the fact. Lo and behold, this knee injury, devastating as it was, a ball player was actually a chiropractor who took my dislocated 90-degree angled knee and straightened it out and said, before you have surgery, wouldn't it be important if you had the best nerve and blood supply and the best alignment of your knee? So if you had to have surgery, you would have the best outcome. I had never heard of such a thing. My 2 older brothers, as you know, are biochemists and immunologists, PhDs and masters, very brilliant. And I was taught from my brothers that chiropractic is quackery. Not knowing what chiropractic is, I decided from the experience I had of 5 days a week, 30 treatments, I was back to powerlifting 1,000 pounds with my legs. I was sprinting and I was playing basketball with yet an unstable knee that needed strengthening. But what a dramatic recovery, having torn the terrible triad, you know, the medial meniscus, medial collateral ligament, and the anterior cruciate ligament. I tore everything in my knee. It was a 90-degree dislocation. I did not have surgery, Doc, for 20 years. I had the good strength. I followed up with procedures, and I kept my legs strong. I did not have surgery despite tearing medial and lateral meniscus cartilages and all the ligaments. I strengthened it. I was back to participating in sports. And at that point, I decided to drop out of the med school program that I was ready to go to and enrolled right away into Palmer College of Chiropractic in Davenport, Iowa. It was a journey and an adventure and stepping stones that my injuries led to my current situation. Having those injuries and now being able to treat those injuries kind of creates a full circle in life.
I hear you. It's so interesting. Chiropractors, we have so many chiropractors who come on, and they all have that life-changing event, and it really gives us our why. And you really did a great job of explaining your why and your mission. Because I was listening today to a public speaker, and he was telling a bunch of 10-year-olds, kind of like what you said. It's not all about you; it's all about all the people you can touch around you. Speaking to that, like I said earlier, you're known as worldwide as the doctor's doctor. So what's the common denominator? I mean, you treat a lot of stars. That's sexy. Celebrities and everyday patients and athletes. What's the common denominator of a sports injury that occurs for most of us?
Really, it all starts, when a house or a building is built, it's built from a solid foundation. And our foundation happens to be the foot. And the foot has basically 3 arches: an inside arch, an outside arch, and an arch that comes across the top. These 26 bones are designed to move with flexible locomotion. And right now, I should advise the audience that this is why we do not believe in a rigid orthotic, because it takes away the natural movement of the foot, which is necessary for ambulation, which is walking, running, participating in sport. You need to have that spring. And if you put something rigid, you're usually just supporting the condition. And what we do uniquely is we correct the condition and support the correction. There's a big difference between what chiropractors, podiatrists, and orthopedic surgeons do relative to the foot complaint. For example, plantar fasciitis is that pain and burning underneath the bottom of the foot. And if you look online, every resource except what I teach tells you to stretch the foot. The problem is, as you can recognize and already nodded your head, the problem is more people have more collapsed arches, which is already overstretching the plantar fascia. So we teach how I correct and restore the arches is very easy. We move the bones back where they belong. What created the arch was the alignment of the bones. What has created a pes planus or a collapsed arch is a misalignment of those bones. So why would you support the misalignment versus going to a chiropractor trained with our protocols and our methods that are very unique to restore the alignment and then support it with a flexible orthotic that provides for natural rhythm of your foot? That's what will protect your knee, hip, as well as your low back. That, my friend, is one of the common denominators. The other is the fact that I've completed a 6,000 case, we're closer to 7,000 right now, in-office studies on measuring bone length. And what we were taught in school, and you were as well, is that the majority of people have what's called is a functional short leg. This is where both legs are even, but they come in the office and one might be misaligned. As a chiropractor, we're taught to realign it. Well, there's a different type of short leg that's called an anatomical short leg. The patient comes in, one leg is shorter, we're assuming it's misaligned and we adjust them, but when they stand up off the table, they go right back in a hole with one leg that's shorter. So of those 6,000 studies at this point, you have, as do your patients and all of our patients, if they have their own joints, have at least a 90% probability of one leg that's shorter than the other. That means the average chiropractor who adjusts a functional short leg walks to the front desk with an anatomical short leg, their adjustment doesn't hold. And you might find that true if you ask the doctor, is it the same short leg I have every single time? And the
Always.
chiropractor is going to say, yes, it's always a right short leg, a quarter inch, or a left short leg. So what happens is a short leg deficiency is usually meaning one leg could be shorter than the other by its misalignment, or one leg is shorter because that's the way you were born. There's another group of people who have a short leg, and that's a result of a total knee replacement, total hip replacement, or a broken leg that has a rod or pins, plates, and screws in the ankle from a broken ankle. These people present to a chiropractor suffering with knee, hip, pelvis, low back, scoliosis, sciatica, and symptoms that are the result of one leg that's truly shorter than the other that's been undetected and therefore never corrected.
Well, I'm going to interrupt you now because Steffi just asked, because she's concerned about her short leg. Her short leg. How do you fix it? Tell everybody how you fix it.
Well, number one, Stephanie, it looks like you have a very odd condition. It's a very rare condition, and that's called a bilateral short leg deficiency. You're actually quite short. But in essence, if one of those two legs is truly shorter, how do we fix it? Well, you know, in today's modern technology and chiropractic, we have a lot of new tools that have come out. They've come out with a new high-speed belt sander to shave your long leg down. No, that's not the recommendation. What we use is a series of heel lifts no greater than 5 millimeters that can go inside a shoe. Beyond that 5 millimeters, you cannot put that inside a shoe beyond 5 millimeters because that changes the angle now of your foot, which will affect your gait, the way you walk, and that'll contribute to many other problems. Biomechanically then, we do the outsole of a shoe, and I will send an illustration of that the shoes are modified by a shoe cobbler.
Cobbler. I like that.
What they'll do is shave the sole of the tread off. They'll cut it off. They'll put the amount we want, no more than 10 millimeters for the first month. Then we'll add the 5 millimeter shim back in for somebody who might be 15 millimeters short. Because you can't put a foot in a shoe with 15 millimeters. There's no room for the foot. So you have to do what's called the outsole. You know, there are several different companies that have what's called insoles. We use a heel lift, and then we use the outsole. One of my very dear friends, as you know, and mentioned perhaps earlier in this, mails his shoes as a star and celebrity on television. He mails his shoes and his wife's shoes to a shoe cobbler that we use here locally because the price in Los Angeles would be the price of us buying 3 new shoes here in the Midwest.
So speaking to that, I understand in the last 3 weeks you treated 4 professional basketball players, the original true Incredible Hulk, Lou Ferrigno, and hundreds of other pro football stars. We can't mention everybody. So what do you want to tell us about being a chiropractor to these athletes, and under what care should someone like them select a chiropractor? I know you wanted to talk about that, and I know you were referring to the Incredible Hulk. So I just have one question from all the guys in the gym. Is he still big?
He's huge. You know, jokingly, I just kind of smacked him in the belly, just saying, hey, buddy, good to see you. About broke my hand. He's amazing. He's been a very dear friend since the very first time I was asked to treat him 38, 39 years ago. And, you know, he said the one thing that's so special about our friendship is I've never asked anything of him where, you know, where most people treat or discuss something with a celebrity, it's about the doctor. And for me, it's always about my patient.
That's right.
You know, he doesn't need to do anything for me except show up at his appointments and do what I ask him to do, which is keep your appointments and make sure the shoes are perfect to keep his body well aligned, which we found.
Now, I don't think people realize you're in Davenport, Iowa. Lou Ferrigno doesn't live there.
That's correct. Los Angeles area.
Right. Okay.
So one of the stars, LPGA player that flew in recently, just a few months back, has been working with the pros pro, David Ledbetter, who was trying to get this professional golfer's head sway, this anterior head sway for a right-hander for the last 15 years. This pro golfer came into me, having a right upper extremity problem for a right-handed golfer, but Ledbetter's been working for 15 years, this gal told me, trying to get rid of his head sway. When I do my biomechanical assessment, I found that with the x-ray, this individual's front leg, the left leg, I believe it was, that was the short leg. And when we shimmed it, it got rid of the sway that he's been trying to figure out and adapting a swing when it was her biomechanics that was a problem. So a $5 shim, balancing her limb length, adjusting the extremity, holds her adjustment, you know, and the problem was us chiropractors, as well as the medical model and physical therapists, anybody in healthcare gets a patient who has a complaint. I want you to think about what I do as a sniper is everybody sees the weed, but very few of us find the root. And when somebody has a hand problem, an elbow problem, or shoulder problem, we rarely think it might be one leg shorter or the feet are out of alignment, causing torque and twist. That torque,
writing things down. Go ahead.
That torque and that twist that occurred from the lower extremity translates into the swing mechanics in any sport. So just think about, ideally, how about the athlete that says, one of my Olympic athletes, a swimmer, I don't want you touching my feet. I want you to fix my low back. How has that worked for you with 20 other chiropractors and physical therapists over the last 25, 30 years of swimming? Says, Doc, I need you. I flew here to have you fix my low back. And you're talking to me about my feet. You don't understand. My feet are a secret weapon. I've got completely flat feet. They're flippers. And here's the fallacy to what he's saying. Let's talk about in the water. The most Olympic best world-class athletes in the water have some of the most flexible feet, which allows them to get the porpoise type of movement to project faster in the water. Now let's talk about flip turns. A flip turn is like the initial dive. Here he is, flip turn, but has no supporting arches, so gets no spring of the foot to push off. So literally, his performance is greatly affected. That's contributing to his low back. He says, Doc, I'm in the water 8-10 hours a day. Why would my feet be a problem? I said, how did you get in the water? How did you get out of the water? How did you dive in the water? How did you flip turn? And how efficient are you in the water? You're wrong. I will not fix your back unless I fix your feet. And I had to provide an education like I do for our profession, as well as my practice is uniquely the only practice in a surgical 3-pavilion surgical center. And the orthopedists work very closely with me because I don't know if you know this, when they remove they do a total knee or total hip replacement, it's rare. And actually that number that was 90% of us who have our own limbs have one leg shorter. If you've had a knee or hip replacement, that number is nearly 100%, 99.9%.
That's incredible.
I had my left knee replaced 14 years ago, buddy. Left knee replaced finally after 30-some years. And my left knee replaced, I started developing right low back pain, right foot pain, and right knee pain. My iliotibial band, you know, that line of tendon along the outside of your leg, everybody? All of it's starting to hurt. So here I am fixing everybody else. I can't fix myself. So 3 months of dilly-dallying with my soft tissue therapist here, ultrasound, cold laser, everything else, stretching to no avail, no better. I said to my staff, my brothers always said, Mitch, you played 2 meters of football without a helmet. So I had my staff measure my leg length to find that a $5 shim, my good leg is now 6 millimeters shorter than my leg that the knee was replaced. Having never known that, I ask you a question, Doc. How many of the listening audience have ever had an orthorencanogram, a specialized x-ray, trained, which is not taught in any chiropractic college in the world? I have a unique course where I train the doctors how to measure this to the millimeter to correct the patient so they don't have to continue going unnecessarily to doctors who are pulling a weed but never getting rid of its root. So it always comes back.
A very small percentage. Where can they contact you for that course?
They can go to training.bestseller, drmitchmally.com, Mally. And you can also go check out my YouTube channel, bit, all lowercase, bit.ly/Dr. Mitch Mally. With those, you could actually see some of the testimonials, as well as on Instagram, some amazing things like the NBA player that was just here last week, Monday, Tuesday, Wednesday, brought his therapist from Florida up with him to his appointment. Failed 3 surgeries to his foot, is in a walking boot with little to no movement of his foot for the last 5 years. 5 years. 3 failed surgeries, unlimited physiotherapy, rehab, and still no movement. You will have an x-ray, not only an x-ray, you will have actually the videos of me adjusting his cuboid, his calcaneus, and you'll also witness an actual testimonial that he provided me. He's shaken up so much, he's able, after the first adjustment of his foot, doc, I got him up off, I said, no boot, get up off the table and walk. He says, I need the boot. No, you don't. Get up off the table and walk. And he walked for the first time in 5 years with motion, up and down, and by the 3rd day, and that's the day of the testimonial, you'll hear him, and he's kind of choked up saying, this is amazing. It's overwhelming to him that somebody could actually restore alignment after all failed surgeries and therapy and soft tissue work failed. Here's somebody that was referred, flew out here, and had amazing outcome.
That was your cuboid. Did you get it?
My name is Jameson Tipping, and I came here to see Dr. Mally from Alex Johnson, a good friend of mine. I've been having 5 years of ankle pain, 3 surgeries, and about 0 range of motion when I got here. It's been an uphill battle for me as a professional basketball player. After 1 treatment with Dr. Mally, he had me out of the boot walking, which was incredible. It's still kind of shocking to me. After day 3, fully walking, eager to get back on the court. I feel like a new man, I really do. So if anybody has any issues, you better be here. And if you're not here, then you don't really care about your body.
I got some questions for you. I'm going to dial it down, and then I'm going to bring it back up before we let you go. Question number 1, since you're an adjustment king, the basic question for the docs and the patients. What is the cavitation, and does it matter?
Oh, that's a great question. So the cavitation that you hear, if you hear a sneeze, does it really matter? A cough? We'll just stop.
On me.
Right? So it's just a body's reaction, right? Well, I took a live audience class from Dr. Chung Su, who has since passed away, who was probably the pioneer of spinal biomechanics and research for over, I think it was 60 years. And when I took his class, I realized that you could have, what he said, anywhere from 0 noises up to 8 acoustic audible pops. Now, when I teach my seminars, it's one of the more prevailing questions asked. Do you get cavitation? Do you get a noise? Do you get a pop? And I tell them, no. In fact, what I'll do as a demonstration is I'll do a neck manipulation, just moving a bone a tiny bit, and you'll hear a pop. And I'll keep my finger there, and I'll move the bone a little bit more, pop, pop, pop. And I haven't even moved the bone in place yet. I'll move it one more time, pop. So here, ladies and gentlemen, my colleagues, you just heard 6 audible noises. Should you have stopped after 1 or 2? And I haven't even set the bone. So my finger is still on the bone. Now I slide the bone right in place, no noise. And at that point, the doctors and students are blown away. And what I like to tell my patients, I reframing in psychology, I tell my patients it's very, very rare that you'll ever hear a noise associated with the bone going in place. In fact, Dr. Chung Ha-Su said, in his voice, he said, it is more important for a patient to think he hear bone go out of place than to believe you hear bone go in place. He says, all you doctors should ask your patients, did you hear the bones go out of place? The patient says no. Then what makes you think you hear it go in place? And the prime example is the self-proclaimed knuckle popper, or the person who tries to pop their neck or their back. I call that job security. Number one, when you pop a knuckle, you're overstretching a ligament and you get a noise. Yet when I put the bone back in place, you get a noise. So either is the knuckle feel better because you popped it, and therefore when I put it back in place, am I making it worse? No, of course not. When I put a joint that's jammed back in place and you hear a noise, the noise is irrelevant. The movement is critical. I hope that helps the audience.
I think it does. So to clarify, you don't have to pop. You don't hear the crack, the pop, whatever term they use, the CO2 gas. You do not have to hear that to have a proper alignment or adjustment. However,
actually, it's been proven to be a nitrogen gas.
Oh, wow. That's great. And if you hear it, that doesn't mean the bones or the joint's been realigned appropriately.
That's correct. 100% correct.
Diagnostically, how do you determine what to do as a chiropractor? Chiropractors have been for years have been arguing. You know, some of the arguments is they just lay face down and they do with the, the lucky seven and all this, et cetera, et cetera. So I need you to pick up
Very
on
good
that.
question. Yeah, I'm a proponent of X-ray. We X-ray our patients. We have to have X-rays because, number one, would you go to a blind brain surgeon? Would you allow your wife to have blind open heart surgery? So when I have discovered in 40 years of work on X-ray, I can show you where the misalignment is, and we feel it on the outside, but we don't have X-ray eyes. You yourself know that many cases in your career that you've X-rayed, you found some things you could not have felt. And because of that, we want to protect our patients. We want to protect our license, but most important, we want to protect our patient. So when I see these misalignments, and you can see where the bones are not aligned, my job then is to restore the precision of the adjustment, which is what allows somebody unable to walk again. You know, how many times in a knee model have you seen somebody with a full long knee brace, immobilizer, and crutches, and you say, hey, what did you do? Oh, I had a grade 2, grade 3 sprain strain injury in my knee. Oh, so explain it to me. You twisted your knee? So let me ask you a question. You twisted your knee, and underneath that knee support the orthopedist gave you is still what? A twisted knee. So let's use the analogy. If my car has a wheel out of alignment and I park it in the garage for 4 weeks, like immobilizing a knee for 4 weeks, it's twisted. You know what's funny is when you take that car out of the garage, you still have a wheel out of alignment. Doc, we call that a wheel problem. And what happens here is the knee is still twisted. I know the jokes aren't that great.
You know what? I think we should take like 3 minutes at the end and let you go raw and see what they like. I think you'll light them up, you know?
All right. So, ladies and gentlemen, my colleagues, as well as the audience at large, when a knee or any other joint is out of alignment, it affects what's called the soft tissue. Whether it's nerve, muscle, tendon, cartilage, the joint tissue, just remember the brain is getting a message, a signal. It's called a Valix phenomena or an afferent pathway. So from a furthest end, back up to the brain and back down to your foot is one of the processes. And this is something which is not traditionally taught and not well understand when it comes to peripheral joints. Like a hand can cause a problem in your neck. A foot can cause a problem in your low back. That is the opposite of what we've been taught, where we've been taught above, down, in to out. This is the other way, which comes back. And that's called a Valix phenomena for a distal or a problem from a faraway area of the body back to your spinal cord up to the brain, which elicits a signal. It's very simple. There's nothing wrong. Confucius say, do not hit dashboard to make gas light go off. Very simply stated, if the gas light comes on, it's your local area of pain, but it's a gas tank that caused it. So your chiropractor needs to be skillful of the peripheral joints and how they affect the spine. I hope that comes through clear.
That resonates. That was very rhapsodic, if you will. Outstanding. So let's do a little quick, because we're going to wrap up soon. Let me give you a little question answer rapid fire. Give me, and this may be difficult for you to say, give me one of the more common joints that need alignment.
The hardest bone in the foot is called the cuboid. It's on the outside of the foot. When you sprain this is an outside of the foot. When you roll the ankle, it creates a wedge right here. And that right there has helped more people by setting the heel back in place for the plantar fascia. That restores alignment. But this outside right here bone needs to be placed back in position. This is all available on my video series. My library of my life's work is the Magnificent Seven Extremities. And they could look that up on basically M7E, capital M7E .drmitchmally.com. And they can look that up and they can purchase the 4 DVD series. It comes together as a package that includes the entire upper extremity, shoulder, elbow, wrist. It includes the lower extremity, foot, knee, hip. It also includes the cervical and TMJ. And my favorite, did you know, Doc, there are 23 entrapment neuropathies in the upper extremity, 17 from the elbow to the wrist and hand. That's on my carpal tunnel and cumulative trauma DVD, completing the 4 DVD set. There are 17 entrapment neuropathies in the lower extremities. And to the audience, an entrapment neuropathy basically means is where a nerve could be pinched either by bone or soft tissue, muscle or tendon irritation, but it's an alignment that causes it. And you don't necessarily need somebody carving on your body. Your body is not deficient in chemicals that you need to cover up your pain, because it's your brain's only way to let you know you have a problem. And you don't have abundant organs that you need to have superfluous organs removed from your body unnecessarily. See a chiropractor that is highly skilled and trained with the Mally method. Learn the techniques, doctors, if you haven't already done so. Go to my sites, experience the Mally method, and make a decision for precision so you too can become the leading extremity expert in your community. Your patients deserve it. You deserve it. Dr. Silverman, it's been an absolute pleasure and honor, and I thank you so much for the opportunity to share a little bit in this short interview. Thank you.
Well, it's been great, and I do have the 4 videos, and that's why I knew about the 23. The videos are fabulous. It's been my pleasure. You've got to come back because I already got some questions on myths of chiropractic, which we'll cover later. And it's been great. I see you at all the shows. I know we're going to be seeing each other next week. Everybody share this, please. This is very valuable. There's always a lot of questions about chiropractors and what we do. I think you just saw an expert really explain the high level. We're not just chiropractors. We're doctors of chiropractic. So Dr. Rob, the doctor's doctor, Dr. Mitch Mally. Hope to see you soon. Dr. Rob, always yours in health.
Thank you. God bless.